I'd like to begin by thanking BIVA for giving me the opportunity to present the findings of this work. We have no competing interests or sources of funding to declare. Gastric impactions are a relatively rare cause of colic in the adult horse, accounting for less than 2% of horses presenting with colic in a recent study. They involve a persistent and progressive accumulation of dehydrated ingesta in the stomach, but are poorly characterized in horses, and definition varies between studies. A fairly well-accepted description would be a concretion of ingesta that precludes visualization of the margo plicatus and remains in the stomach despite a minimum of a 16-hour fasting period. Gastric impactions in horses can occur in isolation, lone impactions, or in combination with another gastrointestinal lesion, concurrent impactions. Lone gastric impactions can have multiple causes, such as ingestion of inappropriate feedstuffs, poor dentition, inadequate water intake, or underlying motility disorders. Gastric impactions have been reported in cases of large colon volvulus and do occur in conjunction with other gastrointestinal lesions. Gastric impactions are often described as primary or secondary. However, it's difficult to say whether the impaction is a cause or consequence of the other lesion, so we've avoided the use of that terminology in this study. It's currently unknown whether presenting clinical signs and outcomes differ between lone and concurrent impactions, and the aim of this study was to compare clinical findings, resolution time, and outcomes for horses with lone and concurrent gastric impactions. We hypothesized that lone gastric impactions would take longer to resolve and would be associated with a poorer outcome. In this retrospective study, computerized medical records at the Royal Veterinary College and Donington Grove Veterinary Group were searched over a 12-year period for horses diagnosed with gastric impaction by gastroscopy, exploratory laparotomy, or post-mortem examination. Donkeys, horses under 1 year of age, and those with a final diagnosis of equine grass sickness were excluded. Lone gastric impactions were defined as impactions appearing in isolation based on a combination of rectal palpation, abdominal ultrasonography, exploratory laparotomy, or post-mortem examination. Concurrent gastric impactions were defined as those occurring in conjunction with another lesion of the gastrointestinal tract, diagnosed by one or more of the methods mentioned above. For outcomes, we looked at survival to hospital discharge and gastric rupture. Data were assessed for normality using the Shapiro-Wilk test, and clinical findings and outcomes were compared between lone and concurrent impactions using the Wilcoxon rank sum, chi-squared, or Fisher's exact test, depending on the type and distribution of data. 113 horses and ponies meeting the inclusion criteria were identified, with a median age of 13 years, and they were a mixture of breeds representative of the two hospital populations. 40 horses were diagnosed with a lone gastric impaction and 73 with a concurrent gastric impaction. There was no difference in age, breed, or sex between the groups. Colic was the most common presenting complaint, seen in 28 out of 40 horses in the lone group and all but one horse in the concurrent group. Other presenting complaints in the lone group were fairly non-specific and included weight loss, poor performance, anorexia, pyrexia, and lethargy. One horse in the concurrent group presented with both lethargy and anorexia. In the lone group, gastroscopy was the most common method of diagnosis used in 25 horses. 8 horses were diagnosed at exploratory laparotomy, 1 with both methods, and 6 at post-mortem examination. In the concurrent group, 23 horses were diagnosed with gastroscopy, 21 horses were diagnosed at surgery, 23 with both methods, and again, 6 at post-mortem examination. Within the concurrent group, other gastrointestinal lesions were diagnosed at surgery in 37 horses, at post-mortem examination in 24 horses, and the remainder by transrectal palpation and abdominal ultrasound. A variety of lesions were identified, with large intestinal impactions being the most common in 16 out of 73 horses. 98% of horses treated received some form of enteral fluid therapy. The two that did not were in the concurrent group and were treated by withholding food until the gastric impaction resolved. Methods of treatment differed between the two groups, with more horses in the lone group being treated with gastric lavage and with carbonated diet cola than in the concurrent group. Looking at the clinical findings on admission, we found that there were no significant differences between the two groups. There was also no difference in time to resolution between the two groups. Both had a median time of 2 days. 23 out of 40 horses with lone impactions survived to discharge, and 46 of 73 horses with concurrent impactions survived, again with no difference identified between the two groups. Gastric rupture occurred in 30% of lone impactions and in 12% of concurrent impactions. We found that lone gastric impactions were 3 times more likely to rupture than concurrent impactions. The lack of difference between lone and concurrent groups is surprising. The outcome of concurrent gastric impactions is undoubtedly influenced to some extent by the other lesion. And lone impactions may also have a variety of causes which ultimately affect outcomes. Time to resolution was similar to other studies. Survival to discharge seems to vary between case series. This case series of 20 primary impactions had a 90% survival to discharge rate, but in the smaller case series below, which is also from a UK population, only 41% of horses survived. So our findings in a much larger cohort sit somewhere between the two. Spontaneous rupture has been previously reported in horses presenting with gastric impactions. In this second case series by Bird et al., 25% of horses had gastric rupture despite attempted treatment. Our finding that lone impactions were more likely to rupture than concurrent impactions may be reflective of disruptions in gastric motility leading to alterations in stomach size and wall thickness. Concurrent impactions were more common in this case series and were seen most commonly in conjunction with large intestinal lesions, perhaps reflecting alterations in motility of the whole gastrointestinal tract and disruptions in enteric reflex pathways. Our study had several limitations. Firstly, being a retrospective study, we were reliant on clinical records for a diagnosis of gastric impaction. The fasting period prior to gastroscopy was not standardized, and it can be very difficult to differentiate a full stomach and a true gastric impaction. Normal horses fed on a hay diet produce a dehydrated mass of ingesta that fills the stomach and can resemble an impaction. It is also difficult to make a definitive diagnosis of a lone gastric impaction, as you cannot fully rule out a concurrent lesion without performing exploratory laparotomy. We also did not examine the use of abdominal ultrasound for diagnosis in this study, as it was not reliably recorded. Comparing outcomes in retrospective studies is always difficult, and multiple factors may affect the outcomes that we looked at in this study, particularly in cases with concurrent lesions. A prospective study with multivariable analysis to identify these factors would be the next step in investigating this further. This study is larger than previous case series, but did not find a difference in clinical signs, time to resolution, or survival to discharge between horses with lone and concurrent gastric impactions. We found that gastric impactions carry a fair prognosis, with 60% of horses surviving to discharge overall. An important finding was that lone gastric impactions were more likely to rupture, and this occurred in 30% of cases. Thank you very much for taking the time to watch this abstract, and I look forward to answering any questions you may have.